A production fee for your Hometown Health Connection was made by Buffalo Healthy Living Magazine and its sponsors.
Life in Western New York and across the world has changed since the COVID pandemic hit in early 2020. Now, almost 2 years later, many of you continue to have questions on the variants of the original virus, the effectiveness and safety of the vaccine, masks, social distancing, and more, which is why Buffalo Healthy Living Magazine reached out to you to get the answers you need on this special edition of your Hometown Health Connection. I am Kate Glazer. Welcome to the program. Joining us for the next half hour is Dr. Raul Vazquez. He is president and CEO of G Health Enterprises and a primary care physician practicing medicine in Buffalo for 30 years. A fellow of the American Academy of Family Physicians, Dr. Vazquez saw a need and opened urban family practice on Buffalo's West Side in 1996. Since then, he created the Greater Buffalo United Accountable Healthcare Network to become one of Buffalo's largest minority employers, serving thousands of patients on Buffalo's West Side. Dr. V, as he is known, is also a proud supporter of the Hispanic community and Western New York overall, recognized by Mayor Byron Brown for his many accomplishments. Welcome, Dr. V. Thank you for joining us.
Well, thanks for having me.
So let's get right into it. Why are people getting breakthrough COVID even though they are fully vaccinated? What makes one person get it over another? And are people who are unvaccinated spreading COVID to vaccinated people?
So, just because you're vaccinated doesn't mean that you won't catch COVID. I think it's a protection that you got built in based on the vaccination itself. What we have is, because of the Delta variant that's been more contagious, not more deadly, but more contagious, we still have a lot of people that are unvaccinated. And as a result of that, they're spreading it to people that are vaccinated. But when you look at the numbers in terms of the hospital, which is real important to look at, is 97.3% of the people that are ending up in the hospital are the ones that are unvaccinated. And 99% of the deaths are people that are not vaccinated. So, even though you're vaccinated, you may catch COVID, but your chances are not as high as someone that's not been vaccinated.
So should even those who are vaccinated be taking much more precautions now indoors at grocery stores and other indoor venues again by always masking?
Well, it all depends on the environment. If you're outside, being outside, a lot of times the risk is lower. So it's not as high as it is indoor. So yeah, if you're around individuals that are not vaccinated, you always have to wear masks to protect yourself in those settings.
Now, Dr. V, do you think that there will be limits again on people congregating in larger numbers outdoors? Should there be? And what about visiting indoors with good friends? How do you feel about that as well?
If indoors with good friends, if everyone's vaccinated, you're in a good space. Outdoors, again, we don't see the infection as much outdoors if you're, not close, that's 6 feet. So if you're outside and someone's 6 feet away from you, you're pretty much in a good space. Whether you need a mask out there if you've been vaccinated, I don't personally do that. But you have to start to kind of continue to follow the rates of the infection. I think if the Delta rate, if this Delta variant is still continuing to rise as a result of not having people not vaccinated, then it's something we'll have to change and look at the CDC guidelines. But for now, those are what we follow, at least here in New York State.
So this Delta variant, like you had said, why is it so much more dangerous, and why are people getting so much sicker who are unvaccinated, including our children?
Yeah, so the Delta variants, it kind of changed the spike protein. The spike protein it's like a flower, and when we first saw the first strands, it was more of a closed type of spike protein. Now it's more open, so it lasts longer, and you're getting more higher viral loads when you get exposed to it. So that in itself, if you haven't been vaccinated, that's what puts you at risk. Not so much individuals that are vaccinated are going to catch it if they do catch it, but the actual infection rates are much higher in unvaccinated individuals.
Now, I have children. I have 3 children, all under 12. Do you have an answer on when there will be a vaccine for children who are younger than 12?
So, we were hoping to do that, and the FDA kind of pushed it back a little bit. So I'm hoping by the end of the year that we'll have that age range, which will be probably 6 to 11, which is where they were looking at. And that would be the Pfizer and Moderna are both running trials right now to see if they get some initial approvals.
It's so important to me as a mom of a child who is actually only 1 year old. So what about babies? What is as far as vaccinations go with babies?
That, again, is still pending.
Okay.
And I'm hoping that not just the 6 and 11, but we start looking all the way down to 2 going forward. So, the immune system, when you're below a certain age, it's going to require a little bit of, looking at it and maybe a different type of vaccine. We don't know yet, but for now, everyone's been using the same vaccine.
Is there an answer on why it's taking so long to get a vaccine for children and babies? Do you know anything?
It's numbers. The numbers are real important, and that's why that 6 to 11 was delayed. It wasn't, the FDA didn't feel that we had enough numbers to really justify it getting through.
If we have children who are in school, are they more inclined to spread it to those who are vaccinated or unvaccinated?
I think both. I think that's the risk that we carry, both. Unvaccinated, it'll be higher, but both can actually catch it if kids do bring it home.
Now, Dr. V, there's so much confusion over boosters. We are hearing about why those who have been fully vaccinated for 6 months getting breakthrough COVID. Are the vaccines losing their efficacy?
So we're looking at that right now. I just feel that in the immunocompromised, the CDC has pushed out that those individuals need to have a booster shot. And so that's the category now. I could see coming forward that it's probably going to be people 65 and over, because we've been seeing in Israel and other areas where that's been added to the regimen. But right now, the FDA hasn't approved it there, but I see us going there. And I also predict that probably within, the beginning of next year, if we start seeing a rise, we may actually add a booster shot. So it would be 3 shots as opposed to 2 shots that we do right now. But for now, the only indications are immunocompromised, and I could see us kind of moving in that direction, because it's what we do with other vaccines, so that are similar in terms of what we use. So for hepatitis B, it's 3 shots. We do 1 month, 1 month after, and then we do 6 months after. I believe we may have to actually, because we have not vaccinated enough people, that we may run into that encounter to really avoid these variants from actually continue to change in our environment.
So that's kind of like herd immunity,
Yes.
Pretty much. So we haven't reached that. Is that kind of what you're saying?
No, we're about maybe 63%, and the sweet spot would have been 80%.
Okay.
And across the country, we're still not even at 60% with 179 million people that are fully vaccinated even today.
Do you have an answer on why the government is not moving faster to get a 3rd shot to people out there?
I don't. I think, we're wasting a lot of actually vaccinations, because they come packed, so the Moderna is 10 in a pack and Pfizer 6 in a pack. So if you're giving 2 or 3 and the timeline is not there, we're wasting vaccines that probably could, if we designed a model besides immunocompromised, at least people over 65, that we can start to kind of utilize them in that particular setting.
Okay. And you mentioned Israel and other countries like Germany so far. They're ahead of the U.S. in getting boosters to people, especially those who are older than 65 and those with underlying health conditions that put them at risk. Can you expand on that as well?
Well, I mean, they're following different protocols, and they're seeing that it is something that's being addressed, and they're seeing basically less individuals get infected that are getting that vaccine. So, we have to wait for the U.S. studies to kind of confirm and support that, and the FDA to kind of give us the sort of go-ahead. But I see that they are doing, they're a little more aware in the data and really following this a little closer than we are.
Sure, and so many questions about boosters. You have so much knowledge, it's really appreciated. Who is qualified to get a booster right now?
Anyone immunocompromised, so that's someone that had a transplant, that will be someone with cancer that's going to immunotherapy, because when they got the first 2 shots, their memory cells to create the immune response might have been weakened by some of the medicines or things that they were taking. That's why they're going to need that booster shot in that particular category of individuals.
And when will the government authorize it for others who are at high risk, such as those with pre-existing conditions and the elders in our community?
Don't know.
Okay.
I'm hoping so.
I hope so too. I hope so too. Do you agree with, people getting the booster now? I mean, do you agree with all of that and making sure people know about that?
Yeah, no, I agree with the booster. And, initially I thought maybe with 2 shots, the booster would have been okay if we were going to get the herd immunity. So the booster is really the same dose. It's not like we're creating a booster shot. So on the Pfizer side, it's the same dose that we give for Pfizer. Moderna eventually will do the same thing. So, yeah, to me, it's important in the immunocompromised, like I mentioned before, but people over 65 with pre-existing conditions will be a category that I hope we get to.
Okay, wonderful.
Sooner more than later.
Thank you. Can a physician authorize the booster for a patient they are concerned about who doesn't fit into that government sort of, standard?
Up to now, no.
Okay.
CDCs and FDA give you pretty much, if you do that, you're kind of practicing outside the line of the law.
And, vitamins are always a very important thing to put into your daily, routine. We hear about how medicine works, but what about vitamins, like vitamin D? How is that helping this situation?
Well, it helps with immunes. It helps with a lot of different things. And vitamins are essential, because your body sometimes doesn't consume enough of them. But it's not a substitute for a vaccine. So I think people think, well, I'll just take more vitamins. I'll do these other things because they don't want to get the vaccine. I just want to... whether you take vitamin D or not, the vaccine is still something that you need to do.
I know when I had COVID, I was actually 39 weeks pregnant. I can kind of speak from experience how it really impacted me. And one thing I heard from my doctor is take vitamin C. Is that something that is also kind of recommended, or?
So vitamin C, the vitamins are all good in a sense, but the vitamin D, like I said, it's fat soluble. So too much of that could be a problem. With vitamin C, it's water soluble. So after a while, if you take a higher amount, all you do is make expensive urine because it's not really going to help you with anything else within your system. So supplements are okay, but with COVID and going through that process, hydration and things like that are also very important.
Mm-hmm. You've been very busy with so many things since COVID hit. I can only imagine how it's been. So talk about how your patients are feeling about things, how it's been for you, and how you're moving forward as a team.
So, I mean, in terms of COVID, we're still testing people, so that becomes important. We keep dashboards on it just to see the trend, which is real important for us. The vaccine, we vaccinated over 11,000 people. So, we haven't seen any bad things from the vaccines. Again, when you vaccinate individuals, if something's going to happen, it's in the 30 days of the vaccine. If it doesn't happen during that time, you're going to be fine. So we have not had any bad outcomes with that.
Wonderful.
So but we still have a lot of people that need to be vaccinated.
Thank you, Dr. V. We will return with more answers to your COVID questions. You can connect with Dr. Raul Vazquez at Urban Family Practice, 564 Niagara Street in Buffalo. There are several numbers to note. The general number is 716-882-0366. For appointments in person or online, you can call 716-247-4104. And if you need help with transportation, call 716-325-1403. We will leave this information up on the screen so you can write it down, and of course online at urbanfamilypractice.com.
Buffalo Healthy Living Magazine is a free, full-color magazine distributed throughout Western New York. Now, more than ever, as we all want our families and friends to be safe and well, Buffalo Healthy Living Magazine is devoted to health, fitness, and nutrition for people of all ages. It's a great read and also has great recipes. Pick up Buffalo Healthy Living Magazine all over our hometown or go online anytime at buffalohealthyliving.com.
Welcome back to your Hometown Health Connection. I am Kate Glazer. We are continuing our special town hall on COVID with your questions for Dr. Raul Vazquez. So, Dr. V, what are the people who only got one dose of the Johnson & Johnson shot supposed to do about getting a booster if they are authorized to get one? And how are you advising your own patients to receive the J&J vaccine?
So, it's 6 to 8 months the terms in terms of the booster, they're going to either qualify for Pfizer will probably be the first. So I don't think they'll get a Johnson & Johnson booster. I think it'll end up being one of the other ones because they've been approved, and Johnson & Johnson still doesn't have the FDA approval for a booster.
Okay, and should people who receive the J&J shot keep waiting for approval of a J&J booster or take a third shot of either Pfizer or Moderna? You might have already answered that, but expand on that a little bit.
I think what's available is what you should take advantage of, and if Pfizer has that approval, it will be the one that we'll use during that time.
Okay, and should a person who got Moderna or Pfizer initially stick with the same vaccine for a booster? And what if the one they received initially is not available?
Yeah, again, you want to, if Pfizer was approved, for a booster, but if Moderna gets approved, then stick to the brand you got before. And I think that's the best way. But because it's a concern to make sure people are protected within that group, whatever booster is available first is the one you should take.
Okay. And is it true that Moderna may authorize only a half-dose booster? And why would that be?
They're still talking about it, so it's what I've seen in the literature, but we don't know it just yet.
Okay. And speaking of the J&J vaccine, we have heard that women of a certain age developed a clotting disorder, which is something that's very, very scary, especially for women, resulting in low platelets. Although this was a relatively rare side effect, do you recommend that women who have not yet received a vaccine get the J&J or opt for one of the mRNA vaccines instead?
So, I mean, the mRNAs, we have so many of them that I think that would be the option. I would say to take the Pfizer, Moderna. But, we are, in the school age areas now, to get back to school, there's a requirement. And you have a lot of them getting the Johnson & Johnson in order to make the requirement and be able to get back to school. So over a certain age, it's where, under a certain age is where we saw the cases where this platelet dysfunction that happens. And we see that with individuals that were on blood thinners before heparin. So it's not something new, but we did see it with the Johnson & Johnson. So my recommendations is the Pfizer and the Moderna in that group. But if you don't have a choice, then you have to take the Johnson & Johnson.
Sure, and you said it was extremely rare that this clotting issue happened.
Very rare, very rare.
Do you think that really scared some women away from wanting to be vaccinated because of everything that came out with J&J?
So, I mean, yeah, but when you look at the situation, it's sort of like we want them to kind of really do some homework and talk to their providers on this. So while I guide more people to Pfizer, Moderna, which is what I have in inventory, Johnson & Johnson sometimes is not something we have in inventory. Yeah, I would talk to your doctor. I think that's the key in this whole process.
Okay, thank you. And women are still worried about the impact of these vaccines on fertility. That's something I have a lot of friends that have expressed their concern about this. Those who are pregnant are also worried about the impact of the vaccine on their unborn baby. Can you talk to us about why the concern is there and what you are telling patients? So
the concern of infertility is true if you have COVID. If you got COVID, yeah, then we're seeing issues that happen as a result of long-term COVID that is going to be an issue. The vaccine in no way affects infertility in any way. And we started vaccinating women early on that were pregnant and now had babies and all that stuff. And there was nothing that affected the kids. And some women were actually involved in some of the cases. So part of the trials for Pfizer and Moderna, people were found to be pregnant after they were vaccinated. And the long-term impact of that has been okay. There has been no complications associated or infertility related to the vaccine itself.
Mm-hmm. Let's talk about the benefits, though, to the baby with the vaccine. So talk about that. I mean, that's something that isn't always talked about, but there's a lot of benefits to the baby when there is a vaccine.
Yeah, and we had some individuals that we vaccinated that were pregnant at the time, and the baby actually got protection as a result of the vaccine itself. So, we had cases where some kids may have caught COVID, and because of the fact that the moms were vaccinated, didn't really get into significant trouble.
Mm-hmm. Also, what have we learned about women who were not vaccinated that contracted COVID? And finally, can you talk about how getting COVID has impacted male fertility? So let's go back to women that were not vaccinated getting COVID and how that really impacted them.
Yeah, I mean, if they weren't vaccinated and they got COVID, it was bad. I mean, we had a lot of morbidity, mortality attached to that, where moms, and there were deaths associated with it. So the obstacle of By getting vaccinated, that was prevented, and we saw that. So, in the beginning of the process, we were saying that, we should have women vaccinated, but it wasn't approved. And as a result of that, we saw that women that weren't vaccinated really got into serious trouble. And the other question you had was?
Yes, so we, going back to it, talking about male fertility versus getting the shot, which protects them. So talking about that with the vaccine.
Yeah, so, remember with COVID infections, there were clot formations all over, similar to women, and people had impotence and a lot of sexual dysfunction with COVID infection. And if you were vaccinated, that's something that you're not going to have.
I know for one thing, like I talked to you about, I wasn't vaccinated because the vaccine was not out, but I actually contracted COVID while I was pregnant. 39 weeks delivered with oxygen on, and just to really go through that experience, that's why it's so important for me to talk about the importance of vaccines and why, it's crucial for women to think about that. And I know it can be very, very scary, obviously, when you're pregnant or breastfeeding and trying to think about getting a vaccine, but do you have similar stories like that where women are just really nervous about it if they're pregnant or even breastfeeding and thinking about their baby? How would you even respond to that? I know you've touched on it, but really personal stories of that.
Well, I think we told them that the vaccine had no virus in it, so we were just tricking the body. So, the concern would have been once you were vaccinated in those 30-day period, if we would have some complications develop. And on all the women that we vaccinated that were pregnant within our system, we had 0 complications. So we're talking about 11,000 people that we vaccinated personally, and we didn't have a single bad outcome, no complications related to that. So yeah, and what we found too is when people found out that they were exposed to someone with COVID, they were happy that they were vaccinated. The child never developed any long-term complications as a result of it, being around someone that had COVID.
And also antibodies. I'm sure there's also a benefit with that as well.
Yeah, the antibodies with the vaccine, absolutely, because it passed from mom to child. So that's a nice way to kind of protect kids, even though we can't vaccinate them.
Yeah.
So that was a way to kind of work around the vaccination model.
And they can never really tell how long a child maybe would have the, sort of antibodies exist in their bodies from the mother. But I was told when I delivered that my baby would have it for a couple of weeks, if not a couple of months after, which is amazing.
Correct. So when you get the first shot, you do get what are called the IgM antibodies, which are not long-term antibodies, but they last for about 2 months. If you have COVID and you got infection, those are the same things that happen, but they don't last forever. That's why if you had COVID, you should still be vaccinated because you want to develop the IgG, the more long-term antibody response. And the booster works more on making the IgG last even longer. And so, we could be looking at 2 to 3 years or 5 years with a booster shot, which is where we want to be.
Wow. I've heard from some people who have had the booster that their side effects were more severe, but they fortunately only lasted a day or two. Can you talk about people's fears about the side effects?
Yeah, so remember, when we give shots, the first time we give the shots, we're priming the body, tricking the body, but then we develop memory cells. So with the second shot that you get for Pfizer Moderna, these memory cells really give you sort of a symptom like if you had a little bit of COVID. And as a result of that, when you get a booster shot, now you've got 3 times or 4 times the memory cells. So yeah, you're going to have more of the symptoms because it's almost thinking that you're getting an infection. Your body response recognizes it, and the antibody response makes you tired. You'll experience it a little bit, but like I said, it will be for 24 to 48 hours, and then you'll go back to normal. You don't want to take medicines prior to that.
Oh, you don't?
You
Okay.
want to take medicines after because it can interfere with the immune response of the vaccine.
So it's like a stronger reaction that you're getting because you might have been exposed to COVID, correct?
Correct.
Okay. And is the booster a different vaccine that was made to be a booster, or is it the same vaccine?
It's the same one. The FDA is looking at seeing if they can edit it a little bit to be more of the Delta variant, but it's going to end up being the same type of vaccine that we've had before because you don't want to recreate what's already working.
Okay, you hit on this a little bit, but let's back up. Should I take medication to ease my side effects either before or after getting the vaccine? You did touch on that, but talk a little bit more, expand on that as well.
Yeah, Motrin, ibuprofen, you want to take after the vaccine. That'll help you with the symptoms. If you do it before, they interfere with the way the vaccine can produce an immune response. So you may actually blunt the effects of the vaccine by doing that.
Okay, and flu shots, let's talk about that a little bit too. Tell us why flu shots are especially important now.
Well, I mean, because the flu, the flu itself, kills 60 to 65,000 people a year. When you put it attached to a COVID, you can have a multiplier effect. So you don't know what you're dealing with. And with the flu, the nice thing is if we give a vaccine, it works fairly well. If you're stuck, if you get the flu, now we got to treat the flu and COVID, and it could be just a multiplier effect. Really cause people to get really sick.
Could you get the flu vaccine at the same time as getting a COVID vaccine?
They're trying to come up with a combination vaccine. That's what they've talked about. But for now, no. You want to keep them separate, because if you get the flu shot and you have a side effect to the flu shot, you're going to say it was related to the COVID. So we try to space it out, at least 4 weeks between the shots, because you want to make sure that whatever side effect was attributed to the right vaccine.
That makes total sense. And can the flu vaccine help prevent COVID and vice versa?
No, it can't prevent COVID, but if you don't want to have the flu and COVID at the same time. So it is important to just, the flu itself is bad enough. Combining the two can get really worse.
When do you think scientists will develop a new vaccine or booster that is stronger and more protective against COVID breakthroughs and against the Delta variant or more deadly variants that may come?
Well, I think what they're doing right now, the booster is sufficient to handle that. I think the biggest thing right now is that herd immunity. We got to get more people vaccinated. If we got to get to 80%. If we do that across the state, then a lot of this stuff we're talking about is something we won't have to think about.
Yes, absolutely. Well, thank you, Dr. V, for answering these important questions. We will continue the important discussion on the next edition of Your Hometown Health Connection. I am Kate Glazer. I hope we have answered some questions you need answers to. Remember, you can connect with Dr. Raul Vazquez at Urban Family Practice, 564 Niagara Street in Buffalo. There are several numbers to note. The general number is 716-882-0366, and for appointments in person or online, call 716-247-4104. If you need help with transportation, call 716-325-1403. We will leave all this information up on the screen so you can write it down, and of course online at urbanfamilypractice.com. Thanks for watching. Be safe and be well.
A production fee for the preceding presentation of Your Hometown Health Connection was made by Buffalo Healthy Living Magazine and its sponsors.